Good morning, everyone. My name is Kelly Fuller. I'm the Vice President of Workforce and Workplace Innovation here at the Columbus Chamber of Commerce. And we're super happy to have you join us today as we enter a conversation around mental health and wellness. This is part of our A Better Us series that the Chamber offers to help encourage and support holistic health within the larger Columbus community. With us today as our guest are Dr. Jimmy Henry, National Director of Mental Wellness with the African American Male Wellness Agency, and Thomas Gunn, Director of Employer Industry Partnerships with the National Center for Urban Solutions. And I'm going to turn it over to them to introduce themselves here in a moment and take us through the conversation. But we'd like today to be participative. So as you're thinking of things, if it's a question or a comment or an idea, feel free to pop that into the chat as we go along. And we'll be sure to bring those to Tommy and Jimmy's attention so that we can have a great conversation. So, gentlemen, I'll turn it over to the two of you.
Good morning, everyone. Kelly, thanks for having us on. Look forward to this conversation. Again, my name is Dr. Jimmy Henry. I represent the African American Male Wellness Agency. We are the health and wellness arm of the National Center for Urban Solutions. And I'm here with my colleague, and I'll let him introduce himself and what he does.
Absolutely. Thank you so much to Kelly and the team, the Columbus Chamber. And thank you, Jimmy. Thomas Gunn, I am the director of the employer as well as the industry partnerships. I've been here with the National Center for Urban Solutions for well over 10 years, going into 11. And my responsibility is build relationships with the industries, create strategies that help the community get connected for the 21st century and the future. Whether that's upskilling, whether that's training, whether that's getting people connected to careers. But we all understand that, through this conversation that we'll have today, that there's some challenges, and we like to see challenges as opportunity. And our organization has always been very connecting in that way of reaching the people, and so understanding what's going on and creating solutions. And that's how we've been able to do that over the last 31 years of our inception. And you'll hear something about we have a number of arms. We have a college called NCUS Tech, where we're impacting individuals through certifications and getting them opportunities, and also education, a school called Academy for Urban Scholars, where we're helping people get their high school diplomas from 1 all the way to 91. We also are in the space of, again, helping individuals understand their health and their wellness better and have some results from it. So you'll hear more about that, and we're excited to be here today on this forum to give you information, but also hear from you.
Absolutely, absolutely. I'm definitely looking for the conversation, but let me help frame it a little bit. I do have a couple of slides that I will share with you, if I may. All right. Everyone see that? Okay. All right. So they were talking about holistic health and community impact. So for those of you who don't know, I actually worked in the healthcare space, a trained medical doctor, and transitioned several years ago into the nonprofit space. And going from the treatment side to more of the preventative side is actually very eye-opening for me because, in fact, our communities deal with so many preventable conditions that if we get them early enough, don't need the interventions that medicine provides. And so here at the National Center of Urban Solutions, as Mr. Gunn alluded to, it's essentially a enterprise composed of 4 different arms, right? And he mentioned NCUS Tech. He mentioned our Academy for Urban Scholars. We also have a behavioral health arm called Afrocentric Personal Development Shop, where we do therapy, counseling around especially domestic violence and substance use and recovery. But here, um, my job really at the African American Male Wellness Agency is to save Black men's lives, right? We do that by reducing disparities in life expectancy, um, especially around chronic diseases for Black men. Our focus is for Black men, but we are inclusive of everyone. We understand that this particular demographic is affected more severely by several measures related to health and wellness. And if you want to talk about the data, which will kind of help frame our conversation, um, think about it. High blood pressure, heart disease, diabetes, many of these things are preventable. However, a great majority of men have these, Black men have these conditions, sometimes not knowing it, right? So uh, one of our signature initiatives is Black Men's Wellness Day, where we provide free health screenings for Black men. And we screen thousands, about 10,000 of men, and we find that the vast majority, over 50, 60% have high blood pressure, and half of them don't even know that they have high blood pressure at that time. So by us increasing the awareness, we can uh, implement preventative strategies to try to change the course and prolong the life expectancy of our men. But you just kind of go down the list. I won't bore you with the numbers, but just know that many of these things can be addressed with education and awareness, right? Think about it for cancer, for example. Um, it's so prevalent among Black men at an earlier age, and we oftentimes wonder, well, why is that, right? But even before the why, we have to provide some solutions to that problem. Um, are there environmental reasons, stress, diet, exercise, um, access to care, right? And then if you want to even bring it over mentally, there are these barriers that we face in our community, right? There are certain stigmas that we face related to going to see the doctor, right? There are certain issues around mistrust in the healthcare system due to infractions of the past that still bear fruit even today, right? So these things we do have to address primarily by increasing awareness, providing access, and then actionable steps. And that's what our agency is about. So whether it's physical health, mental health, almost 20% of Black men have mental health. However, they tend to be less likely to seek help for it. Again, in part due to the stigma around being a man, not showing weakness. There's cultural stigma around mental health as well. There's even religious stigmas around mental health, right? Sometimes we can over spiritualize these things, but our job again is to bring awareness to these issues so that we can just have a conversation. So I look forward to, again, just the conversation that we're having here. I'll stop sharing right now. See if there's any questions you may have, Kelly. To be honest.
Yeah. Thank you for that, by the way, Dr. Henry. I appreciate it. And these statistics are alarming when you see the impact. When we talk about stigma, whether it is religious or cultural, what are some of the things that we can do collectively or that you guys do organizationally to help break down those stigmas so that people seek the help, the access that they need for early detection and for care?
I would, Jimmy, if I can jump in just real quick
Yeah,
and I'll
yeah.
switch it back to you. I'm glad you asked that question, Kelly. I want to preface something that we started the wellness initiative because we were doing workforce, and that was in 2004. And so we did this because we had a number of, particularly in the women and men that were going to work, but there was a lot of men, and particularly the African American men, who were getting sick, and didn't in at alarming rates. And we found out that a lot of them hadn't been to the doctors in years. And so a lot of the conversation was like, well, what are we going to do? And so we decided to start with screenings, but then we said screenings aren't good enough. We got to get them connected to a doctor. And so, as you can see, the information that Dr. Henry put out there, we kind of got with of that doing, some workforce projects. And It's been growing ever since for the last 20 something years. But I think some of the solutions is building awareness. And so we had to build awareness and understand really what was going on in the community, but also building trust. And so you've got to really, get particularly men, because we're knuckleheads and we don't like to listen. Um, Hopefully there's not a lot of women on the call that are agreeing. But with that being said, we have to do it in a way that is not invasive, but at the same time can show them those numbers and say, hey, you get to be around for your family for some more years. Every single year, we have at least 5 people that get rushed to the hospital from our wellness day. And that's the reality. And didn't even know that they were getting ready to have a heart attack. And we, as an organization, and all of our partners, were able to help that person stay alive, per se, if you will, for some more years, or even find out that they got cancer, find out that they are on the route to heart disease. And it's alarming, but we have that support too. But I'll shift it over to Jimmy as well to kind of give some more progression from there.
Yeah, no, that's really good. So I think we have to frame the conversation, right? Just a little bit differently. Uh, we try to give, again, I work in the mental wellness space now, right? So giving men permission to prioritize themselves, right? And sometimes you have to cut against the grain of what we're taught generationally, right? You know, I have a strong faith background, but I believe in faith plus therapy, right? I believe everyone should see a doctor, dentist, therapist without question, right? It doesn't mean something's wrong with you. It means you're trying to prevent something from being wrong with you, right? So I think you have to reframe the conversation for men particularly. Um, it's it's a tough demographic to crack. We know that women typically are the highest consumers in the household. Women typically bring their families to the doctor. Women typically bring their families to church, but that's a little bit out of position in my opinion, because in fact we find, especially when we do our fatherhood piece, when men are involved actively in a situation, especially in their child's education, that child performs so much differently, right? So putting the responsibility and onus back on the men, but giving them permission to actually do so. I think sometimes our like selflessness is to our detriment. My daughter asked me the other day, we are at the hospital visiting someone, and she's like, why are a lot of the women nurses? I'm like, well, it doesn't mean the men can't be nurses, but there's a nurturing spirit that many women have. But on the flip side, many men are doing other things like Mr. Gunn in the workforce, right? Physically intensive jobs, factory jobs, construction jobs, maybe even technology, what have you. But you can't be a great worker. You can't be there for your family if you don't prioritize your physical and mental health. Right. So we need to have this conversation and do so collaboratively in our community.
Thank you, Dr. Henry. Really quickly, we do have a question from Larry, one of our guests here. He's asking, are there mental health resources specifically structured for Black men in the professional workforce?
I would say, Larry, that's a great question. And a lot of times I'm going to tell you there's probably no. And that's why we exist. And again, for anyone who needs the help, but I think what we're trying to do is get employers there are different groups that they currently have, but sometimes those groups only meet and there's really no follow-up. And so I would always suggest that you find out what are the groups that are offered at your employment, and are they really fixated on ensuring that mental health, what are those options, is it open, and if not, again, Dr. Henry mentioned we have an amazing number of events that we do monthly that we'll go over here soon, that if you don't have it at your workplace, could be an option, where we find people that come from all walks of life that are, you know, you know, top executives all the way to individuals who are, working in entry level. but they're coming together. They're having really good conversations. And there's also clinicians there if necessary. And so that gives us a chance to work with those who may not have that structure at their workplace. So obviously it's depending on the place that you're at.
Thank you.
But that's such a great question because there is a need.
Correct.
And Mr. Gunn and myself have attempted several times with several community partners to try to implement something like that on site at an institution, to make access easier for the men that work there,
Right.
to provide a very needed service.
Um, we also just wanted to call everyone's attention. One of our guests, Chelsea Elliott, also just popped in just another resource to the chat for those that might want to find out about more events focused on Black men's health. Thank you, Chelsea.
Thank you so much.
Yeah,
So
absolutely.
I'll let's see, I'll pick up a little bit where I left off. And um, again, so around the mental health data, let's talk a little bit about suicide, and especially around young men. So 15 to 24, suicide, the second leading cause. Black men succumb to suicide at 4 times the rate of Black women. And there's been a trend recently where the rates have increased, the attempts have increased, especially since COVID, related to isolation and chronic illness and lack of support. Even though there's more awareness in 2025 than there was 20 years ago, 40 years ago, there's also a great need. And we're still underserved in these areas. There really aren't enough providers to meet the demand, especially culturally competent providers, right? There are, let's just keep it real, there's differences between cultures, right? There's difference between geographical areas of the United States, right? The language is different, neighborhoods are different. So finding someone who gets you, whether or not they look like you, but who gets you, is truly important. And we talked about trust. Trust, probably we'll talk more about that, but that's probably the biggest thing that we're facing is trust. Substance use. So overdose. Black men have the steepest increase over the past decade, right? Um, as of 2022, African Americans made up about 38% of the overall deaths, though they only represent 24% of the population, right? So we're disproportionately affected by the rising increase of overdose deaths, right? So these are things that we are facing. These are the problems that we are bringing awareness to, and our program provides solutions to these problems, right? So our Black Men's Wellness Days around physical health, we provide free health screenings. Men who get screened and want to go through a cohort to improve their health go through a program called Black Impact, which we partner with Ohio State University. You Got This is around diabetes awareness. We give patients continuous glucose monitors, which help improve their compliance and their numbers. Uplifter is our women's wellness program. It's our problem too. It focuses around opioid awareness and Narcan training to help prevent overdose deaths. Financial wellness. We have actually a major financial wellness symposium coming up October 16th, and our mental wellness initiative called Real Men, Real Talk, which really helps address the fact that men's life expectancy are 10 years shorter than their counterparts. Again, higher incidence of preventable diseases, drug misuse, abuse, incarceration, and suicide. So what is it, right? So it's essentially a safe space for men to express their emotions in a healthy manner before those emotions express themselves in an unhealthy manner. That can be physically, high blood pressure related to stress, diabetes related to stress, cancer related to stress, right? Or mentally, depression, anxiety, addiction, suicide. So we're on the front lines addressing this issue for men who may be going through it, but hopefully preventing these things from even arising, right? So this is a free monthly event in Franklin County. It's a safe space. Meals are provided, facilitated by trained individuals like myself, where we have a conversation. We essentially take barbershop talk and format it in a way that invites men and empowers them to speak, but then gets them connected to resources, right? It could be behavioral health, it could be substance recovery, it could be workforce, whatever that man may need, we are able to connect them to that need. And currently we are on a summit tour. So our summits take our conversations on another level. So we provide mental health screenings. So we screen for anxiety and depression. Thus far this year, we've identified that at least 40% of men have mild or above anxiety and depression through our mental health screenings. So a lot of men don't even know that they're dealing with these things, right? So then we can connect them to a therapist or counselor to help with that, right? We have breakout sessions or intimate conversations around a certain topic. We also bring in a celebrity guest, one that is a mental wellness advocate that our community resonates with. So they identify, when someone is vulnerable enough to share their wellness journey, it empowers someone else to, say, they're going through it. It's okay for me to share that I'm going through it too, and then seek help. So we try various strategies, right, to take the edge off, take the anxiety off, take the apprehension away from seeking help around mental health and physical health.
I just had a quick comment and maybe a question. So obviously, from the event that you talked about, Tommy, with, 5 individuals through a screening, you saved their lives. I mean,
Mhm.
literally. And then, Dr. Henry, what you just talked about with the mental health screening as well, that's life-saving, those
Absolutely.
individuals to get them those resources and that help that they need. The impact that you all are making, I mean, is right there. It's demonstrable. So like what other ways are you measuring impact? I mean, how else are you looking at wellness outcomes among Black men in our county and in our region?
Um, that's good. So for us, it's not just number of men screened, but it's connection to referral sources. So men who've gone to the doctor, men who have gone to the therapist, right? We do provide serial screening opportunities to see, well, are they trending a certain way? Um, we provide, community care calls. There's some continuity of care there just from the men in our community. That gathering, that social interaction, that community, men keep coming back because they're receiving a benefit. So it's very relational, and sometimes it may not be quantifiable, right? But the men who come, they're not just coming for a free meal.
Yeah.
Trust me, right?
Yeah.
And so these men, also job placements, right? So men who are seeking employment or training, they get referred to Mr. Gunn, and then he takes it from there.
Um, Thank you for that, Dr. Henry. And one thing I want to kind of follow up with what you just said. So the way that you're measuring, kind of those referrals, the continuity, the follow on, anecdotally, what are some of the things that you hear from participants either at the screenings or at the Real Men Real Talk?
I can jump in there. And this is probably one of my most exciting pieces. As I said, I've been here for 10 years and I see there's some questions, so we'll definitely make sure we get back to those. Is you gave me an opportunity to be with my family again. That's one. One was, I thought I was particularly healthy, and we've had people who, work out every day. But again, it goes back to that awareness. They don't know their family's history.
Right.
And so you don't know that you have a history of heart disease. Maybe you weren't told that. And again, this isn't a victim thing. It's giving them the information that maybe they don't know, or maybe they did know and they figured, hey, you know what, this is not something susceptible to me because I do all of these things right. We had someone who was in perfect shape, and ended up having cancer. So it's hearing those kind of things from the participants. But I would also say, even with our Black 100 project, where we worked with OSU, we started that in the middle of the pandemic, or like at the end, almost, if you will, depending on how you're looking at it. And it was created to develop journals. And these journals will be used and can be used by any doctor to really understand um, the process of how Black men are getting sick. What are some? And so when we do all of those anecdotal things and say, okay, well, we gave them, you know, access to find out if they had challenges. Okay, so if they did have it, this is what we did to help them with it. We use those studies to help other doctors know how to deal with Black men and their health and give them really good information. And this is across the country. This is not just here in the Franklin County area. So that's another piece that we're doing, is really creating an awareness, not just for those who are getting the help, but for your doctors, for people in the healthcare space. I know there's a question about funding too that we'll address, but I wanted to just share that. And even some of the doctors are coming back and saying, you know, the fact that we've got these individuals in a group and they got a trainer and they're working together, they're pushing each other, and they're knowing what their susceptibilities are, and holding themselves accountable on the same end. That's what we're looking for in what we do. So,
And helping back to Dr. Henry's point too, helping to build that cultural competency that's
yes,
needed.
yes.
I'm going to jump into the chat. Larry's got a question for us again, given the reduction in funding for healthcare by the federal government, do you see an opportunity for faith-based collaboration to fill that gap in healthcare resources? And if so, are there positive examples that you may be able to share?
So currently, we collaborate with faith-based institutions on a regular basis. So we outreach to them. We're invited oftentimes to speak during their services about the work that we do. So we have a great footprint in the faith community, and I in part feel like that's is part of why I was brought to the agency. When you think about health holistically, I feel like you can't leave your faith out of it, right? So when you think about your body being a temple and what that really means, but from resources, if we all put our resources together, we can have a greater impact. So for example, when we reach out to churches, we encourage them to bring their parishioners, bring their congregation. We create something called passion teams, right? And we create the whole narrative around taking care of your health uh, because of your faith and for your faith. If you believe that you have work that God put you here to do, you need to be able healthy in order to do that. So we have fun competition. We have contests around that, right? Which church brings out the most members, who gets the most men's screen, right? All in with the purpose again of saving lives, right? Um, I saw Keisha, Miss Martin, ask about the follow-up. So the follow-up, we partner. So again, we have a behavioral health practice part of our enterprise. They follow up with the men from the mental health screening directly. The men also have option to see anyone of their choosing. We also have a virtual partnership with a large national provider if they want to go that route as well. But the idea again is some men have never even thought about their mental well-being, right? And then, of note, we had two men recently at our summit who had suicidal ideation, right? They didn't come in with a plan. They didn't, appear out of their source. But when you're asked that question, and then you have the opportunity to speak to someone on site about what that question means, then they're taken to a private area. That whole situation is monitored closely, and then they're given the help that they need. So I believe we are doing some transformative work here very much so in part related to our partnerships and our collaboration in the community. We can't do it without everyone else moving in the same direction that we are.
That's amazing. And I mean, just in time, right? I mean,
Yeah,
it
absolutely.
happens and it's the resource is right there available. Lauren Sands with the Human Service Chamber of Franklin County has this question. Do you have any advice, either one of you, for someone starting up a workforce wellness initiative?
I would say, what is your goal? Know what your goal is, and who's going to be a part of that goal. Getting those people together and having real conversations. Um, you know, NCUS has been around for years, and we haven't always had all the partners that sometimes people see at our events. At one point, it was just us and a few, maybe CareSource and a few others. Um, but what our CEO has always said is Honda builds cars and we build people. And if you're fixated on the people, the rest will grow out itself. But I think the first part of the strategy is really understanding the scope of what you want to do, and having the other people around you or partners that are believing it and people that are going to make things happen. A lot of people get together and meet, they create things, but there's no movement. And as I mentioned at the beginning, when we first started this, we were doing workforce. We actually weren't doing wellness, and it happened because a lot of individuals were getting sick, and we needed a solution. And so we had to build relationships, and CareSource was one of those first organizations we started working with very little funding. I know funding came up, but sometimes we got to go outside of that and figure out, well, what can we do until we can build that impact in. So I would say those would probably be the first pieces is have a plan, and make sure that everyone that is partnered or working with you understands that plan, and can help you meet some small goals and metrics, and have some real outcomes, that can be met. Because if not, it just becomes a thing where there's a lot of people a part of it, and people don't really know what their roles are. And at the end of the day, the biggest piece is the people. And so when you look at our wellness day, we get 50,000 people to show up well, this year was 50,000 people in one space. Over close to 300 vendors. That doesn't happen without relationships, and that does not happen by chance. And so there's a lot of intentionality that has to happen and trust, first from the community. I don't think there's a community you can go in that doesn't know about the Wellness Day. And if they don't, that just tells us that we got more work to do. So, which we have ran into those individuals, like Jimmy mentioned.
Hey, Nick, how you doing?
There's a gentleman that came,
Oh, yeah, we
to
all
an
got it.
event
Yeah.
who was pretty much saying that he had suicidal thoughts. But he came to the event because we said we had pizza and we had somebody coming and it was going to be a cool time. But he got there and actually told the truth and said, hey, I actually need some help. But I wasn't going to tell anybody else. So when we get those opportunities, we're very intentional. But again, that comes from planning, strategizing, having partners there, and the clinicians. When they're in the room, they barely get to talk because the individuals feel free to let go of maybe years of conversation that they haven't said to anyone else. And so, again, I just think that you need to have a plan with people that you're working with are ready to move quickly, and you understand the scope of what the community needs that you're going to be connecting with.
That's good. That's good. And that circles right back to trust. So I would say don't do anything just to check a box. Like if it's just a HR box thing, then don't do it because the man won't be bought in. They need to know that they can trust you, that you care. Like they care less about how much you know. They want to know that you care. So that really means showing up for them in a way that they need you to show up, and
Mm-hmm.
then being consistent in how you show up. And sometimes that can be hard to do in a place of employment,
Right.
especially where they may feel like if they disclose certain things, it may be held against them, even though you may say that it's not. So, if you can do it internally or even bring in an external partner who's very much objective and very much focused on the employee first, then that would probably be ideal. But like Mr. Gunn said, have a plan, because you got to be in it for the long haul. Because the second that guys feel like they can't, it's hard to get that trust back from it. Once you get them, you have to maintain them and handle them with care. I mean, men are sensitive creatures. We're human, right? And sometimes we may have this rough exterior, but when we open up, um, we can be quite fragile. And I don't mean that in a derogatory term. I mean, we need to be handled with care just like anyone else. So once they know that you truly care about their well-being, not the bottom line of the company, it will have a different feeling, and then you'll get the outcomes that you want.
So being in it for the right reasons, it can't be just something to check a box or be
Yeah.
performative or say that we're doing this because we want you to be more productive and necessarily at work. It's because we care about you as a human being. We want you to be well and healthy, and balancing that, as you were saying, Tom, the being ready to go quickly, being ready to act, but also having the patience to understand that trust takes a long time to build, and how fragile it can be if that trust is broken, how to kind of
Absolutely.
rebuild that. I think we've
I think
got a
there's someone in the chat.
up on my glasses. Yeah, here. So John Lucas, is NCUS currently utilizing healthcare technology such as telehealth for mental health, behavioral health, to remove patient monitoring for chronic care? I feel these advancements have helped bridge the gap between men and the doctor's office.
I'm gonna shift it to Jimmy, but
Yeah.
before he gives that answer, and I'm glad he asked that. The other unfortunate part of that is technology is so high right now in the telehealth space. Um, One of our entities, as we mentioned, we have a college, and we knew that a challenge was, especially with some seniors, is the digital piece, is understanding technology. That is a mental. We know that it's not said a lot, but just being able to use the computer to take care of whatever you need for your health needs is a challenge, and has been. And so what we try to do is work with entities to help them be more digitally savvy, and and for the last 3 years we've had a digital skills awareness, and then we built awareness, and then we started moving, as we mentioned. And so we had seniors come in, we brought food, they loved it, and then they learned how to use their phones. They learn how to take their phone and be able to say, well, how do I get to my doctor, or how do I get to my information? And because I can't really go to and we made them comfortable, and we have healthcare providers as well as our own staff together doing it and involving them. And it allowed for them to, one, take away the nervousness of it, and they were able to complete. So we've had every year, probably for the last 3 years, at least over 50 plus seniors completing classes, just so that they can feel comfortable, because a lot of times those are the ones that are struggling a lot with the telehealth piece. So I wanted to mention that, because when we talk about solutions, we found that yes, we are using some of those systems, and we're encouraging that. We're working with OSU and others, but then we had to pull back and say, wait a minute, there's some that have never used this, and we've seen it during the pandemic. Well, how do I do that? How do I even click on this? What's my password? What do I, things that some of us use day to day, and we're not taking that into consideration. Even some that are working and they have to work from home or whatever that may be. So yes, we are taking those things into consideration, but we did have to um, implement that, utilizing one of our arms to ensure people are also getting those skills and awareness to be able to progressively have some progressive usage.
Absolutely. And I think those are some great points. And while it's good to have that as an option in a bind, I think especially during COVID, we realized there's some limitations to that, right? When you talk about the most of communication is nonverbal, when you're, interacting with someone, a patient, you want to look for nonverbal cues oftentimes, which you don't get with telemedicine. So, I think in person is always the best. It's almost a difference between texting someone versus picking up the phone and calling them versus meeting them for coffee, right? So there's levels to it. Face to face is always, always better.
I'm going to ask you both maybe a bit of a personal question, but in a recent panel that actually Chelsea Elliott and I were on together around mental health and wellness, we were joined by by an MD from Ohio Health talking about healthcare providers themselves trying to stay healthy and well, especially when we think about mental health and wellness with all that you're dealing with. So if you're not comfortable answering the question, that's okay. I'm throwing it out there. But how do you take care of yourself? How do you stay, both of you, like focused and committed? Because this is heavy work sometimes. Like, how do you administer self-care?
That's a good question. So I'll go first because I'm as an MD who experienced a burnout while practicing medicine. I have a little bit of I'm very sensitive to monitor my calendar, establish boundaries, and maintain my boundaries with certain things. So, you know, we when you're a service-minded person, you have a tendency to overextend yourself and overcommit yourself. So things that I do, again, maintaining boundaries, um, exercising regularly, self-care. And for a guy, it could just going to the barbershop could be considered self-care, you know, doing anything that you prioritize yourself, journaling, going for a walk with the family, things of that sort. And I think one thing that you can't overstate is rest. You know,
Mm,
we have to rest. You know, we have, you know, a weekend for a reason. You know, if you're a believer, you have the Sabbath for a reason. Take that time to really re-energize yourself, recenter yourself. Because when we skip that rest part, then we're operating at a deficit.
mm,
And when we never pause to replenish ourselves, we're still giving, but we're giving not our best. So when we want to serve others, we always, you know, you get on an airplane, they always say, put your oxygen mask on first, right? So you got to remember to take care of ourselves first. And that's, you know, that's a great question that oftentimes we don't get asked. You know, rarely does someone ask, hey, doc, how are you doing? You know,
mm.
when you're a servant, a leader, people really ask how you're doing, and it almost feel like a thankless job. I know pastors and other leaders deal with this oftentimes, not really having someone ask them or have the concern like how they're doing, and then actually helping them in an area that they may be deficient in, right? So, yeah, so there are things that I do. I know Mr. Gunn does things as well.
Yeah, I would say for me, especially as of now, as Jimmy said, I have a family as well, and definitely doing things with the family. But I also think that taking 5 minutes every day, um, as crazy as that sounds, and doing nothing,
Mm.
just just sitting and thinking about really not even thinking, just taking 5 minutes to yourself. You can fixate it on whatever you want, but it helps. Also, one of the other things I do, it's my background. Crazy enough, my background is in exercise science, and so I was already doing it. I was doing coaching. I play sports, but um, so I do work out, but I think the other thing is um, listening to short. I don't like to listen to the long books. A lot of times I don't have time for that. But in the morning, when I come in and when I'm leaving work, particularly when I'm leaving work because there's so much stuff going on, and I would suggest this to anyone, is listening to something about that, like a TED talk or something that would allow for you to stay focused on your goal, your personal goal of who you are. Instead of turn on the radio, turn that on. I even did it this morning, taking my boys to school, and they were kind of thrown off because they're younger, and they were like, "What the heck is this?" But after about 10 minutes, they started to listen, And so it just changed the dynamic of what could be. I'm not saying every day is perfect because it is not. So don't think, for instance, I'm a very positive person, but at the same time, I think doing those little things will allow for you, and including rest, to give back to what you take out because yeah, it is work, and it's hard to watch someone say, realize I actually had one of the people my first year in 2015. I got him off a bus, and that person's about to have a heart attack, and I didn't even realize that. I'm sitting having a conversation, not realizing that they could have died, and but I got to be a part of his story, and so just little things like that. So it can wear on you. So I just think that you got to take those 5 minutes, and then when you leave work and when you're coming back, listen to something that is not just positive but is progressive, and it might be some accountability pieces in there too.
Thank you both for sharing that. I do want to respond really quickly to Keisha. Yes, we are recording, and we can share this. She's shouting out the great information that you both are sharing with us today. So
Yeah,
much
absolutely, Keisha. Thank
gratitude
you.
for that. I also want to just reflect on what you both mentioned. I think so often we feel like we have to earn rest, right? Like it's if I work really hard, then I can, relax. And it's a priority, or it should be a priority, just like getting the right food into our bodies, right? I mean, allowing ourselves to have that time, just to regenerate and just to be still. Our friends at Replenish Spa, I think they are doing, I can't remember if it's monthly. I haven't been to one yet, shame on me, but they do like a whole day or a few hours of reflection or rest on a Sunday at the Columbus Museum of Art, which I think is wonderful.
Nice.
Bring your mat, bring whatever, just come be still for a while. I think there's some guided meditation to it as well, but I think we often forget how important that time is, whether it's 5 minutes, like you said, Tommy, or a more intentional, time as well. I know we're getting close to the end, but I do have another question. And I asked this, I think, in a lot of the different scenarios that we're in, but despair is real. We know that people, often find difficulty in finding hope, or how they can like find a shred of hope or something to kind of really hang on to get themselves through something. Where do you see those hopeful moments in the work that you're doing? Where do you see the most opportunity for us as a greater community to do better so that we can have better impact and support for Black men's health in Columbus?
Wow. So I think the hope is that, race is real. I think race is more than just a social construct. We're different. We're meant to be different. But I think that being seen and being heard is very important. So the more that we have these conversations, you know, we can learn others' experiences and we can validate them. So the fact of the matter is there are many atrocities in our history that still bear fruit today, and we can't ignore those things, right? There's a certain, I think the term is weathering, that happens when you exist in this country as a person of color, and that can bear stress that you may not even aware of. So when Thomas and I get pulled over, we may have a different visceral reaction than someone of a different color, and that could be for good reason. So I think when people express their experiences, I think the hope is that there's an increased level of understanding, empathy, and compassion, right? So then we can see each other as human beings, right? Who have more in common than we do different. And then we can sit in the seats of sorrow and hope with each other. And, the more people that we have in the same mind frame that tomorrow will be better than today, not while acknowledging and validating each other's feelings
Mhm.
and past events, but still hoping for a better future together. And then you can work together. I think there's a lot of division, and the division keeps us in silos and moving in isolation. And that hurts everyone involved, right? So the more inclusiveness, the more diversity creates more impact. And ultimately that's what we want.
Thank you.
Yeah, I would definitely say, along with what Dr. Jimmy Henry said is, we got to be honest, obviously, with some of the things that are in front of us. But then I would take it, even a step further and say that, come with some solutions. We mentioned the Wellness Day. When we first started, we really didn't have that many individual companies and partners, and now it's grown. But that grown through conversations, uncomfortable conversations, but also through solution-based opportunities where we're saying, hey, you're looking for, if it's an employer, hey, you're looking for, individuals that could be really great as, your operators, your C-suite people. Here's a different way to look at that. They're here, and not just for African Americans, women, minorities in general, but just having more of a real conversation that leads to some type of outcome. And that's where we are as an organization, is we're going to put the things in the forefront, but then we're going to say, all right, how do we, help this individual? So we had an individual who came to Wellness Day, had great skills in technology, but didn't have a job. And he needed to get a health screening. Well, we were able to get him connected to JP Morgan Chase, and he's doing well right now. And he's been doing well for the last, because that's, if you can't pay your bills, that's another challenge, right? And so making that one, coming together, having those conversations, making some connections, and then being able to tell stories is our goal. And so if you're thinking about how you can do that, and how you can, send them to our events. If there are, there's other events that we're putting in the chat, and other opportunities, but do something. And then out of that doing something, let's check to see what was the result. And so, as like Jimmy said, we want individuals to get their health screenings, but we bring the vendors there, and we do these things throughout the year purposefully to make connections, and keep things going over the year. So it's not just the one, hey, we had this, it was great, and we keep it moving. No. So just consistency, and then finding somewhere to be a part of what's going on, and a part of the solution, is probably the biggest pivot, if we had to leave you with anything.
Thank you. Lots of great comments in the chat about great discussion.
Thank you, everyone.
Yes, thank you, Melissa, Keisha, Larry, everybody. We've so appreciated this time with you both today, Dr. Jimmy Henry, Mr. Thomas Gunn. Thank you for your time. Thank you for your openness and your conversation. And we just encourage everybody, please take care of yourselves, take care of each other, stay safe and be well. And we'll see you very soon again, hopefully, for more conversation.
Take your 5 minutes. It's okay.
Take your
Absolutely.
5 minutes. That's right. Do it.
And listen, to learn more about what we're doing, follow us at aawellness.org. All right.
Okay.
Everyone knows a black man in their life who needs to be connected with the work that we're doing. So please share.
And we just popped it in the chat here at the chamber. So thank you all, everyone. Have a great weekend. Happy Friday Eve, and we'll see you all very soon, we hope.
Thank you.
Bye-bye.
Bye-bye.